Hi everyone, good evening. I hope you're all well and safe as we venture now into phase 2 of COVID-19 easing of restrictions. For those of you who are newcomers to our webinar series, the last one in fact, the Marie Keating team would like to extend a very warm welcome to you. And for those of you who have been able to tune in over the last 5 weeks, you are very welcome back. This evening is the last of our 6-week series of webinars, and it has been fantastic to be able to connect with you all since the first webinar on the 6th of May, would you believe? This evening's session is going to focus on managing side effects of treatment, but with an emphasis on the management of chronic fatigue and memory loss and poor concentration, two very common side effects affecting those of you on ongoing treatment, and for some also who have come through treatment but still have lingering effects. Before we go into that though, the Marie Keating Foundation would like to acknowledge that life has changed for you, and for some it has changed more than others. We have addressed some of the emotional, social, mental and physical issues over the last 5 weeks, but there are many other issues to be addressed, such as spirituality, sexuality, and financial implications. There are other side effects to be addressed too, such as pain, shortness of breath, and peripheral neuropathy as examples. So please keep an eye on our website for the rest of the year and see what we can offer you. I hope you have been able to use these learning experiences as an opportunity week on week to make an action plan for yourself and work on achieving it over the last 5 weeks. But make sure it doesn't end here. Keep on going and make an action plan for you and something you can do. We're going to have a presentation from Mary Moriarty in a few moments, and she is going to tell us how to look after some of the side effects experienced during and after completion of treatment in this time of cancer and COVID. And as I said earlier, the emphasis is going to be on chronic fatigue and poor concentration and memory loss. So please sit back and take away with you what is important to you. I am Helen Forrestal, Director of Nursing Services. Oh, sorry. I can't seem to move the screen, sorry. Just bear with me a second. So there we are. I'm Helen Forrest, the Director of Nursing Services at the Marie Keating Foundation. Of course, there are housekeeping rules, and those of you who have been involved for the last 5 weeks will be very clued into housekeeping with webinars. So you're in your own home, make yourselves comfortable, have something to drink, and do make sure you can get up and move around when you need to. We know from listening to Laurie McDermott that moving every 20 minutes is extremely important. Make sure that you can see and hear us. If you have a phone, maybe silence it or turn it off, whatever suits. We have Jennifer Sinnerman, our Senior Communications Manager in the background, who has a new role with us managing technology for all of these sessions. So Jennifer, thank you very much for helping us out. As an attendee, you do not have the ability to speak or put on your video. But very importantly, there's a question and answer session during this webinar. And this is going to be moderated by our senior oncology nurse, Bernie Carter. So Bernie, thank you very much for working away there in the background. We do feel that this is a very important part of the webinar and very particular to you as the person listening in. We would love you to participate during the webinar by asking questions, and you can do this either anonymously or by name, whichever you would prefer. You will find the Q&A button on the bottom of your screen. Click into this and type in your question, but make sure you press the return or enter key. In that way, we will receive the question here. If you see questions being submitted that you would like to ask yourselves, there is an icon that is like the like icon on Facebook. So maybe click into that, and that will actually push that question to the top of the queue and is very likely to be answered. You will also see a chat button, and we generally do not use this for the questions and answers. The webinar itself is going to be recorded, and this will be available on our website and for those who've registered within the next couple of days. It's also really nice to know who we're networking with virtually. In a room, we can see, you know, who's in the room and who we can connect with, but virtually we can't. So we would like to say a big thank you to Roche, who are committed sponsors for this 6-week webinar. And it has been really quite magical, and we've had some very nice evaluations and comments from that. So thank you as well to those who've tuned in. I'd like to welcome our Marie Keating nurses and staff, and Liz Yates, our CEO. And also those of you who maybe have attended our 6-week Survive and Thrive programs face-to-face and have learned from those and are willing and enthusiastic about learning further. Our members of our Positive Living group, Women with Metastatic Breast Cancer, and to the wider community of men and women with metastatic cancer. And you, the women and men of Ireland who have been affected by cancer and understand what it is like for you and your families to live through this, especially now. So you received an agenda, and we've been through most of this now. We're on week 6, so it has been a lovely 6 weeks, I think, and these are our panelists. So if you remember, Aoibhinn Bannon, our first week, Laurie McDermott, Breed Leddy, who spoke about sleep and sleeping well, Eddie Murphy, Professor Michaela Higgins, and finally tonight we have Mary Moriarty. So I'd like to introduce Mary. Some of you may already know Mary. Mary has worked with us in some of our group work, and very welcome, Mary. Mary holds a number of roles as part of her work with the Psycho-Oncology Service at St. Vincent's Hospital. Mary is a CNS in Psycho-Oncology and a systemic psychotherapist and complementary therapist. So very varied work going on there. Mary works both in inpatients and outpatients at the time of diagnosis, during treatment, and into survivorship and at the end of life. Mary has completed an MSc in systemic psychotherapy between UCD and the Mater Family Therapy Program in 2017. And her research thesis focused on the experience of parents of young adults with cancer. Mary is a member of the Irish Association of Nurses in Oncology, the Family Therapy Association of Ireland, and the Irish Council for Psychotherapy. And Mary contributes to a number of teaching programs within UCD itself. Mary is a master trainer with the Stanford University Chronic Disease Self-Management Program, and the Cancer Thrive and Survive program, which we also are, and Mary and I have worked together on many occasions with this. Mary's special interests include family therapy, chronic disease self-management, cancer survivorship, and persistent cancer-related fatigue. So Mary, I'm going to hand over to you now. I'm going to stop sharing my screen and I'll allow you to share yours. You're very welcome, Mary. We're delighted to have you with us this evening.
Thank you, Helen. Thank you very much. I just want to put this onto the big screen. Okay, thank you, Helen, for your very warm welcome. I'd like to thank Liz and the CEO of the Marie Keating Foundation and all your nursing team for all their hard work, particularly in the last couple of weeks. It's tremendous what you've achieved, given the challenges that we've had in the last couple of weeks, and I'd like to commend you on that. And
thank you, Mary.
Thank you very much, and thank you for the invitation. I'd like to also thank the audience before I start for their time and attention this evening. And this is a very general presentation, Helen, so you know, there might be some pieces that won't be relevant to everybody, but I hope that everybody can get something from it. So I just want to stop sharing for a minute and just go back, if that's okay. I just need to get this back. Now, apologies. Is that okay, Helen?
I can't see it on screen there, Mary.
Okay. few little techie difficulties now here.
Of course, we're all experiencing those.
Okay, so I'll just open it up again and just let's see what happens.
You share your screen there, Mary.
Okay. Have you got anything there now, Helen?
Yeah, that's it now, Mary. Yeah.
Okay, that's great.
Oh.
Okay. So the topic that I'm going to focus on tonight is fatigue, and I'm going to talk a little bit about concentration challenges as well. So fatigue is cancer-related fatigue. It's very different to any other sort of fatigue. Normally after a week's work where we're busy, maybe if we've taken on a big project at home, maybe if we're taking on a big project in the garden, or just had a particularly busy week with family life or other challenges, anything stressful, normally we recover after a period of rest. However, with cancer-related fatigue, that's not the case. Before I say any more about cancer-related fatigue, I just wanted to mention that we're all individuals, and for the purposes of this talk this evening, what I would say, and I say this to a lot of people that I meet in my work, is don't compare yourself with anybody else. Your particular cancer journey, your experience, your treatment, it's all individual to you. So try, if you can, not to compare. I often meet with people about fatigue or many other topics really, and they will say, oh, well, my friend's friend is doing this, that, and the other, and they have the same treatment as me. But I do say, everybody's individual, everybody's different, everybody's disease is different, everybody's treatment is different. So try as best you can, even though it can be really difficult, not to compare. And as I said earlier to Helen, not everything in this presentation will be relevant to you, but hopefully you'll take something from it. So what is cancer-related fatigue? Well, a lot of people say to me, it feels like you're running on an empty tank all of the time. And you'd love somebody to come along and just wind you up, recharge your batteries, because it feels like your battery is never fully recharged. What happens with cancer-related fatigue is that no matter how much you rest or sleep, you don't feel recharged. It can be very debilitating, it can be very difficult, and you feel excessively tired or exhausted all or most of the time, not related to any recent activity and not relieved by sleep or rest. There are many causes for cancer-related fatigue, and that's why sometimes it can be really difficult to help address it. It can be difficult sometimes for the medical team because there might be multiple causes. But usually, if there is a cause and something can be done about it, then it's really helpful for you to talk about it with your medical and your nursing team, wherever you're being treated, or with your GP. And so some of the causes I've listed here for cancer-related fatigue are anemia. Sometimes the treatments for cancer affect your bone marrow and you can become anemic. And if you're anemic, you're very tired and you might feel a bit breathless. Pain can cause fatigue. Side effects of medication, surgery. When you've had some surgery, you can feel very tired after surgery. Chemotherapy, radiotherapy, immunotherapy, hormone therapy, all of those therapies can take a lot out of you and you can feel very fatigued. Low mood and fatigue are often connected. And sometimes when I talk a little bit later about persistent cancer-related fatigue, which is fatigue that continues after you've finished treatment, sometimes low mood or depression symptoms and fatigue can be very much connected. After you've had treatment for cancer, you can become deconditioned. Long periods of time in bed or resting leads to deconditioning, and it's really hard then to get back going again. physical inactivity, sleep disturbance. And I know that Breach, spoke a lot about sleep. And so, what I would say is to use this webinar series as lots of tools to keep in a toolbox, and, tap into them as a resource. Because sleep disturbance will definitely interfere with your energy levels and is definitely linked with fatigue. Poor nutrition, and I know Avian has talked to you a little bit about that, or a lot about that. So again, tap into that lecture. Sometimes we have high expectations of ourselves and high expectations of our ability, and sometimes we're disappointed maybe with our energy levels. So I would always say, if you're struggling with fatigue, be kind to yourself and be gentle with yourself. Other issues that might be causing fatigue would be thyroid problems. So, if your thyroid is underactive, you can become very tired with that. Sometimes when you've had cancer treatment, you spend a lot of time resting. Very often during the day, you might watch TV in bed, you might spend longer periods of time on the couch, you might be on your laptop in bed, on your phone. And Breach talked about the sleep-bed connection, and that's very important as well in terms of cancer-related fatigue, particularly persistent cancer-related fatigue. So what are the effects of fatigue? Some people think fatigue is inevitable and that there's nothing can be done about it. And so fatigue affects between 70 and 90% of people who have a cancer diagnosis, but very few people actually report it to their medical team. And I think sometimes that's because people feel that they can't, that it's part of life after you've had treatment, and that there's nothing can be done about it. But there actually is something that can be done about it. You saw in the earlier clip that there's lots of causes for fatigue. So if those causes can be addressed, if your anemia can be corrected, or if you can get something else for maybe pain relief, if what you're having at the moment is not adequate or working for you. So it's really important to talk to the medical team and let them know how much fatigue is impacting on your life. Fatigue can really interfere with your quality of life. It can really, you can feel isolated, you can feel separated from friends and family because you feel that you don't have the ability maybe to enjoy outings. And I mean, I know there's not a lot of outings right now, but you might be just too tired even to join in Zoom group meetings or family events that are on Zoom. We're all grounded, I guess, and have been for the last couple of months. And things are beginning to start opening up again. But for some of you, the cocooning may be continuing. Fatigue can impact on relationships. It can impact on your relationship with yourself, but also your relationship with other people, with family and with friends. And you might feel that you don't have the energy maybe to meet up with people and to talk to people on the phone. And really you can experience maybe a disappointment in yourself, particularly if you compare yourself with other people, and if other people you perceive or you think that they're doing a lot of activity and that you just don't feel able to. And therefore it can interfere with your enjoyment of life. It's really important to acknowledge your sense of achievement when you have achieved something, when you are fatigued. And that might be something really that you might consider quite small, but it can take a huge effort for you to get up and to move around and to do some activities during the day. So I would always say to people to, acknowledge your achievements, no matter how small you might feel that they are. You might have difficulty completing tasks because you're just too tired. So they're the effects of fatigue. People tell me when they're trying to describe fatigue to other people, it feels like they're carrying a 10-kilo weight on their feet. They talk about having heavy limbs, maybe arms and legs feeling heavy, and just feeling really, really, really hard to complete any tasks. So this picture actually should have a 10 kilogram ball, but it didn't come out on the presentation, so apologies for that. Before I go any further, I want to make a distinction between fatigue during active treatment, because you know, a lot of the treatment that you're having, chemotherapy and radiotherapy in particular, will cause fatigue, and a high proportion of people experience fatigue at that point. So that's one part of fatigue. The other part is fatigue that is persistent. And when I talk about persistent cancer-related fatigue, I talk about fatigue that persists for maybe a long time after treatment has finished. And usually the marker that we would put on that is 6 months or more. But there is help that you can get for that as well. And I'll talk a little bit about that later on. But I do want to make that it's an important distinction, that people who are right in the middle of treatment right now, if you're experiencing fatigue, that's different to persistent cancer-related fatigue. Sometimes people experience fatigue at different times. Sometimes people don't experience any fatigue when they're having chemotherapy, but do with radiotherapy, and vice versa. Sometimes people don't feel any or experience any fatigue when they start treatment, but they might experience it at the end, and they might experience different levels of fatigue even within one day. The other point I want to make is that, you know, if you have a new or an unexplained symptom or pain, you know, please report it to your medical team or your nursing team. It's important, and particularly if you are trying to manage fatigue. There definitely is something that can be done about fatigue. It's not inevitable. It is something that is a feature for a lot of people. A lot of people feel they can't complain about it, but you certainly can do something about it, and you can certainly work with your team to try and address it or manage it in some way. People often ask if there's a medication that can help with fatigue, but as such, that's not directly the case. Usually the medication would be used to treat something else like pain, or like if your thyroid is underactive, you might need some medication to help with that. If you're experiencing a lot of nausea, you might need some medication that can help with that. And certainly if you're anemic, there might be something that can be done to help with that. And if those things are corrected, then that in turn will help to relieve some of the symptoms of the fatigue that you're experiencing. So just some coping strategies. So this again would be really for people who are in active treatment right now. And so the first thing that I'd say is to pace yourself and prioritize. Do the most demanding activities at a time of day when you have the most energy. So plan out your day and pace yourself. Inform yourself and your medical team, and use a notebook or a diary. And I have a picture of it there at the bottom of the screen. And I tell a lot of people to use a notebook. One notebook. It's really helpful to put all your details, all your information, telephone numbers maybe of your healthcare professionals, all in the one place. Details of your appointments, phone numbers for different departments in the hospital. But also you could keep a record of your fatigue and maybe notice what days or what times of the day you have most energy and when you have the least energy, and then use that to plan your day. From a practical perspective, what I would say is get as much help as you can, particularly when you're in treatment. Now, for a lot of us, that's really hard maybe to ask if you've been a very independent person and if you find it difficult to ask. But what I always say is that family and friends, you know, are always really happy and willing to help out, usually. And if you give them a task, and if you're specific, and if you give them something maybe that they're good at or they enjoy doing, you know, you might actually be giving them a gift. So if people offer to help, take it. You know, obviously, if you're cocooning, you have to be really careful right now. You have to stay away from the shops. So use any resources that you can in terms of online shopping, you know, maybe people dropping the shopping to you, but please ask for help. As well with the household chores, the cooking and the ironing and all those bits maybe that maybe before you did yourself, but maybe now you could get some help with. And I often say to people, maybe this is your time and you know, you can give back at another time, but right now maybe you're the one who just needs some support or some assistance. So in terms of planning, prioritizing and pacing, for those of you who've done the Cancer Thrive and Survive programme, you'll know about the 3 questions that they suggest that you ask yourself. And I think those questions are really helpful in terms of fatigue and fatigue management, particularly when you're in treatment. And the first question is, does it have to be done by me? The second question is it important? And the third question is, does it have to be done today? And they can be really helpful questions to use to kind of prioritize, okay, is that a job for today or can it be left till tomorrow? Or can somebody else do it? So I encourage a lot of people to use that strategy. In terms of persistent cancer-related fatigue, we might look on that a little bit differently, and I'll go into more detail about that further on. And, you know, when Laurie was talking about exercise and, you know, and I talk about this a lot as well, and particularly with persistent fatigue, sometimes if we save up our energy too much, we can become deconditioned. So it's like a fine line. If you're in treatment, you need rest. And there are particular days when you won't be able to do very much. But there might be days when you have a little bit of energy. And so just do what you can on those days. For people who are experiencing persistent cancer-related fatigue, what I would say is that sometimes it doesn't work to store up energy. It can work in the opposite way, is that if you store energy, you can become deconditioned. So what can you do? Well, you can take a management position. You can manage your fatigue. And in terms of managing for fatigue, what I would say is research all resources. So use this webinar series as a resource. Tap into the webinars, you know, and write down some of the points maybe that the presenters have made, particularly we'll say about nutrition and exercise. Definitely talk to your medical team about pain, about poor sleep, about nausea, about concentration challenges, anything that you're experiencing, really. Last week in the presentation, Professor Higgins talked about planning your appointments. And I know the appointments are all different now when you're not attending the hospital, but I'd still plan for your appointment. And I would have my list ready. I would keep that close to hand because you get a phone call now. But I would make that list out, maybe have you know, a piece of paper on your bedside locker or have it on the fridge. And when a thought comes into your head about the appointment or a question that you have, write it down. And then nearer the time of the appointment, concise or bring down your questions maybe to a few. And tell the doctor at the beginning of the appointment that you have some questions, but also have a pen there and your piece of paper so that you can write down the answers. Professor Higgins did say last week that if you wanted to put the phone on loudspeaker and get somebody else to listen in on your phone call, because sometimes it is helpful to have, you know, an extra pair of ears who can clarify with you that what you did hear was actually what you did hear. But writing it down can be really helpful. A lot of people become anxious before appointments, and sometimes when we're anxious, we can't concentrate. And it's very hard for us to remember what our questions were. And it's very hard also for us to remember the answers. So I suggest to everybody that I meet to write those questions down and to plan for that appointment in advance. And again, I would say to definitely plan when it's a virtual appointment. In terms of other planning, plan out your day and your week. When you know when you have the most energy, do the most demanding tasks at the time of day when you have the most energy. And, you know, when you're planning, and again, I would try and go with something that's achievable. And again, that's something that in the Cancer Thrive and Survive programme, it's very much based on what you can achieve. And I've given you the 3 questions, and I think those questions are really helpful, particularly if you're in treatment right now. I'd also say to take a break from fatigue. You know, it can be overwhelming. It can be really challenging. It can impact on your mood. It can impact on anxiety. It can impact on enjoyment. But if we're in it all the time, and a little bit of like when COVID-19 started, and you know, we were hearing after a while, you know, to take some breaks from social media, and to be careful what we tuned into, or be careful where we got our information from. I'd say the same thing about fatigue. If you are experiencing fatigue, it can be helpful to take a break from it, to, you know, engage in enjoyable activities. You know, watching a movie, watching a funny movie, maybe watching, you know, a series on Netflix, linking with friends on Zoom or video, WhatsApp, FaceTime, whatever you can do, writing letters to friends, you know, reading, listening to music, maybe doing things that you haven't done for a long time. And, you know, I know maybe that because people have been at home and can't go very far, lots of us have engaged maybe in bigger jobs at home because we have the time now, we can't go very far. So, you know, we might have taken on a big task like, you know, cleaning out a particular cupboard that hasn't been cleaned out for years, or tidying up something. But make sure that you do acknowledge the achievement that there is in that for you. And definitely take a break from fatigue, because if we're in it all the time, and we're thinking about it all the time, and we're focused on it all the time, it can be really challenging for us. So yeah, definitely take a break from it. What I would say about communication in relation to fatigue is that communication is a fantastic resource. So communicate with your team when you have your visit to the hospital. So I know in the day centre where you are maybe attending for treatment, that you will be asked about your level of fatigue, but sometimes when you're finished treatment, you're not asked about that. So when your appointment comes round, make sure that you tell the medical team how much this fatigue is interfering maybe with your quality of life. Maybe use a number out of 10 to describe it, and write the symptoms that you are having in your notebook so that you can recall them back to your team. In terms of communicating with family and friends, ask for some help. And sometimes what happens when people are finished active treatment is that friends and family who may have been involved you know, during the time of treatment might pull back a little bit because they think that you might need help. But if you're experiencing fatigue, you will need some help for a little while until maybe it's more manageable. But be specific and be clear about what you would like help with. Think about what your friend or friends or family members might be good at doing, and listen carefully if they ask you what you would like help with. In terms of family members or friends, what I would say to you is clarify if you're trying to help somebody who is experiencing the side effects of treatment or is in treatment. Listen carefully to what they're asking and clarify. It's often really helpful for caregivers and friends and family to be given a job or given a task. We all kind of like that, and if we get clear direction, it can make it really helpful for us. It can be really hard for us to accept help, but you know, your turn maybe will come to give some help back in a different way. So I just want to talk a little bit about persistent cancer-related fatigue. So when we talk about persistent cancer-related fatigue, we're talking about fatigue which has lasted for 6 months or more after treatment has finished. So a few years ago, Dr. Anne-Marie O'Dwyer and Dr. Sonia Collier in St. James's produced a wonderful programme, a manual and a DVD on persistent cancer-related fatigue. And it's based on cognitive behavioural therapy because that's been proven to help with the management of persistent cancer-related fatigue. And that programme is excellent in terms of helping people to learn about how their thoughts might be impacting on their feelings and on their actions, and how thoughts and actions may be impacting on fatigue. So, if you are out of treatment for a year and you're experiencing a lot of fatigue, it is worth having a conversation with your medical team about it. We do run a programme in St. Vincent's based on the St. James's model, and people tell us that they really have found it very helpful. So please, if you just take that message away, that something can be done about fatigue. So I know Laurie went through exercise, so I'm going to say very little about exercise. She's the expert on that. But it is important in terms of fatigue. It's important to get up and move around, and when you are trying to manage persistent cancer-related fatigue, it is about increasing your activity levels, looking at your diary, looking at how you think about your fatigue and how you think about exercise. So I know we're all grounded a little bit right now, but I know Laurie gave you lots of tips on how you can manage exercise at home. So a little bit around concentration. And so lots of people experience concentration challenges, and there's lots of different names for this, and some people call it chemo brain or chemo fog. It is something that people experience, and it usually resolves when treatment is finished. But people talk about having memory lapses and forgetting things, not being able to remember things that they would normally remember, having trouble concentrating, not being able to multitask, trouble remembering dates, names, and sometimes even bigger events, finding it hard maybe to answer the phone and cook dinner at the one time, trouble learning new skills, trouble reading and concentrating, and taking longer to finish things, and trouble remembering common words. So again, there are some exercises, or there's some ways that you can manage that. And but before I go to that, I'll talk a little bit about the reasons. So again, poor sleep is tied in, and fatigue is tied in with the concentration challenges. So poor sleep, concentration challenges, fatigue, and maybe low mood or emotional distress or depression can be all interlinked. Nutritional deficiency, so that's why Avine's talk was so important. Hormonal changes can impact on your levels of concentration. Alcohol or other substances, maybe if you have an infection. So it's important maybe to address any of those issues too. And it's also very important not to assume that just goes along with treatment. And I would definitely be telling my medical team, if you feel that your memory or your concentration hasn't improved when you finish treatment. So how do you cope with concentration challenges? Well, what I usually say to people is to use a planner or a diary, and you can use your phone. You can use the diary in your phone. You can use the note section in your phone to make out notes for yourself. Make use of your resources. Exercise your brain. And when I talk about exercising your brain, I might mean things like Sudoku, crosswords, reading, maybe writing something after you've read something, keeping on top of the news, and bearing in mind what I just said earlier about not in the news too much either, getting adequate sleep, getting up and moving around, doing some exercise. Exercise improves your ability to think and focus. Keep a routine. And that's really important. You know, kind of again going back to that idea of you doing the most demanding activities at the time of day when you have the most energy. But definitely keep a routine in terms of meals, and keeping important objects like your keys or your wallet in the same place, using one notebook. So very often people might have one or two notebooks, and they might have, you know, bits of paper here and there. Try and bring them all into the one place. Try and avoid alcohol, and try not to multitask. So they're just some coping strategies for you that you might find helpful. Maybe, you know, if you're living with other people, maybe ask them to clarify, or they might notice times when your concentration seems to be maybe not as good, and maybe that's when you're tired. So maybe have a conversation with them. In terms of fatigue and concentration, poor sleep, fatigue and concentration are all interlinked, the same as maybe low mood and fatigue is interlinked, and pain and fatigue. So that's why it's important to address those issues. Again, what I would say is inform your medical team. What I'd say as well is that you might be very aware of your concentration challenges, but it may not be obvious for other people. So, you know, bear that in mind too, that it's not just it's not, other people may not notice, and that's okay. But if it helps you to feel better, then maybe communicate that with them. Definitely keep a record of the challenges that you are experiencing, and keep that in your notebook as well. I just wanted to say, before I finish up, if that's okay, Helen, is it?
That's fine, Mary, sorry.
Okay, so I suppose the take-home message for me tonight is to use the tools, any tools that you have. You know, I've given Helen a couple of websites, and one is the National Comprehensive Cancer Network website, and they have some patient information on the management of fatigue. And so, you know, use recommended websites, use these webinars. You know, there are other resources and online classes that you can tap into, particularly in terms of doing exercises at home, or if you're cocooning. You know, there are a lot more resources now than there were back in January and February. And, you know, people like Helen and her team have really stepped up and provided lots of resources, so use them. If you are experiencing fatigue or concentration challenges, you know, it's hard not to maybe get cross with yourself or get frustrated with yourself. It's completely understandable. But, you know, if you are in treatment, maybe be gentle with yourself and compassionate with yourself. This is difficult. It's difficult anyway, but it's even more difficult right now with everything that has gone on in the last few months. You know, people are not as available to help. You know, everybody's trying to, you know, manage new challenges. So a bit of gentleness, a bit of kindness towards yourself, and tap into other resources like mindfulness and relaxation techniques. And so before I finish, I'm going to do a breathing exercise, which you can use as a relaxation technique, and you could use it at times when you feel stressed, or maybe use it when you're, you know, trying to get to sleep at night time. Definitely be kind to yourself. And in that notebook, you can always acknowledge your achievements every day. You know, when you're experiencing fatigue, it might be hard to step up one or two steps of your stairs. You know, so acknowledge what you have achieved. And then the last thing I'm going to say is acknowledge your achievement for attending this webinar tonight, for listening to me, and for giving us your attention, because that takes energy as well. And people have been telling me that, you know, Zoom and Zoom links are taking a lot out of them. And that's, you know, people maybe who are not having who are not having treatment right now. So definitely congratulate yourself and congratulate your achievements. It's really important that we do that, and sometimes we forget what we've achieved or what we're trying to do, and it's important. So I just might do the breathing exercise now, Helen.
That's fine, Mary.
Okay, will I stop sharing my screen?
You can leave the balloons up for breathing. I think that's nice.
Okay. So the first thing I'm going to say is, find a comfortable position to sit in or lie in, or stand in, whatever's comfortable. Make sure you're comfortable. This can be done lying down or whatever position is easiest for you, and be sure maybe to relax your shoulders. For a lot of us, when we feel tense, our shoulders tend to rise up to our ears, and the space between our ears and our shoulders becomes narrower or shorter. So what I would say is to try and relax down the shoulders and make a bit of space there. I need to do that for my own shoulders now. Place one hand on your tummy, just above your belly button, and then the other hand just over your breastbone or on your upper chest. And then breathe in through your nose to the count of 5, nice and slowly. If you can't breathe through your nose, then just breathe through your mouth. And you should feel your tummy kind of expanding or coming out to meet your hand. And then just breathe out nice and slowly through pursed lips, as if you were going to blow out a candle. And then just do that again. And it should take you longer to exhale or to breathe out than it does to breathe in. And that can be a really, really helpful exercise if we're in a particularly challenging situation. I often say to people, go into another room and just breathe, and take time to just let those shoulders come down and come away from the ears. Okay. Thank you very much, everybody. Okay, Helen.
So Mary, will you unshare your screen?
Thank
you. Thank you very much, Mary. That was beautiful. Lovely calming presence. I'm sure we're all very relaxed now, and we've learned a lot. But I think some of the comments you've made within your presentation are really kind of resonating, I'm sure, with me and with many people in the audience. And it's something you said, it's fatigue. Very few people report it. And it's a must, isn't it?
I think it's really important, Helen, because something can be done to help, whether you're in treatment or whether you're finished treatment. If you're anemic, you can get something, something can be done about that. If your thyroid isn't functioning properly, something can be done about that. There's no guarantee for everybody that it's something kind of from a medicine point of view or, medication, something can be done. If you're experiencing the persistent fatigue, then certainly cognitive behavioral therapy has been proven, and lots and lots of research has been done on it, that it does help.
Yeah. And something else that's quite striking that you said is comparing and feeling disappointed. Another huge lesson for people to take on board, isn't it?
People often say to me, and they come and they're really upset, and they say, well, my sister's neighbour had the same cancer as me and had the same treatment as me, and she's back at work and she's flying and she's doing this and she's going to the gym. I know nobody's going to the gym right now. And it can be really, really, even people find it hard to even explain to this person who's telling them about the other person. But you don't know what the other person's cancer was or is. You don't know what treatment they've had. You don't know how their body has responded. So never compare. It's hard we all compare, we all want to look at other people, but try as far as possible. And you know, I would say, don't be cross with yourself.
Yeah, really important.
Yeah, we all have that kind of inner critic, and you know, which can hold us back in life. And so it is, yeah.
Yeah. Okay, Mary, you ready for some questions?
Well, hopefully I can answer them, Helen. And if I can't, I'm definitely happy to come back to you over the next couple of days with answers. So
Great.
yeah, fire ahead.
Okay, so hi, Mary. This is anonymous. Hi, Mary.
Okay.
In addition to fatigue and tiredness, I go through my treatment. I find my mood gets very low. Can you advise anything to lift my mood? I'm afraid mindfulness is not the silver bullet for me. Thank you.
Okay. So what I would say about that is that sometimes it is difficult, you know, when you're in treatment and you don't feel physically well, for your mood to be up. So, you know, we all get days, we might get 2 or 3 days where we do feel our mood is low or dipped, and that's okay. We might be all fed up. If somebody's having a lot of physical side effects to treatment, you know, I wouldn't expect you to be top of the world. It's okay to not feel okay. It's okay not to be positive on those days. You know, mindfulness, I suppose I don't teach the mindfulness program in St. Vincent's, but my colleagues do. And so we usually wait until people are finished their active treatment before they join the mindfulness program, because it's quite demanding, like you've homework and that to do. So what I would say to that person is that's okay. You know, different things work for different people. Again, like what I said at the beginning, is you're unique. What will work for you mightn't work for somebody else, and vice versa. So it's kind of about figuring out, if you can, what will work for you.
Great. Yeah. Okay, I have another anonymous question here, Mary. Hi, Mary. I'm really enjoying your presentation. Thank you. That's actually after flipping on me. Bear with me a second now, Mary, and I'll bring it back.
No problem.
I have heard that CPD oil helps both fatigue and poor memory caused by cancer treatments. Is it safe to use CPD while on chemotherapy?
Okay, so hello, and thank you for your very kind comment. I suppose I couldn't really answer that question. I think that's something that I would definitely discuss with my medical team for sure. It's always helpful to talk to them about any other treatments that you're considering. So I don't know, I can't answer that question, and I'm sorry, but thank you.
I think that's fair enough. Yeah, it's very much for the oncologist, isn't it?
Yeah, yeah.
Okay, I have one here from Kieran. Hi, Mary.
Okay.
I am 1 year post-treatment. When will this fatigue stop?
Okay, hi Kieran, thank you very much for your question. So if you're a year post-treatment and if you're experiencing fatigue, then something like the St. James's program could be really helpful for you. So cognitive behavioral therapy, but before you would start that, you know, obviously you'd need to be assessed properly to make sure that you don't have any of the other physical causes like the anemia. So worthwhile discussing that with your GP or your oncologist or whoever you're attending, and get those things maybe sorted first, check all that out. And then, you know, the CBT program kind of gets you to look at your thoughts around fatigue and gets you to do things maybe differently to what you've done before. And so that could be helpful for you, for sure. But start with your doctor. Start with the physical causes that I talked about there. You know, and so I can't say when the fatigue would go, but what I would say to you is you could get some help to manage it, and definitely something to challenge it.
Okay, thanks, Mary. There's another question here. It's quite similar, I suppose, really. It's from an anonymous attendee. Hello, Mary. Will my memory improve when my chemo and radiation treatment stops? My short-term memory is very poor at present. Thank you.
Okay, so generally the research would tell us that it does stop. that it improves once treatment has completed. I don't know exactly what treatment you've had, so I don't know where your radiotherapy was to, and that might have an impact as well. So, but I would definitely talk to my team about that, because if you're finding that your memory is very poor, I would definitely tell them so that they can monitor it, or they can check any of those physical reasons for your memory being challenged, for sure.
Okay.
And just the website, the American Cancer Society, Helen, is a very good website in terms of the concentration challenges.
We'll have that on
Yeah.
recorded. Yeah, brilliant. Another anonymous one here, Mary. I am really struggling with low libido and ongoing related feelings of guilt. I am no longer on treatment, but have no interest in sex anymore. What is your advice?
Okay. So again, I think what I would do about that is I'd definitely do something about it. I think I would talk to my GP. Again, I don't know the ins and outs and the details, and sometimes they would be very relevant, particularly for a question like that. So I think it's worth doing something about. Sometimes something like that is hard for people to bring up in consultation. It's a difficult subject sometimes for people to bring forward, but it's really important that you have a quality of life after treatment is finished. So it's worth talking about that. So maybe talk to your GP to start with, and definitely. I'm trying to think now, because if virtual appointments are happening, that can sometimes make that easier, or sometimes it can make it harder. But have you got anything to say about that, Helen? Because
well, I think a full assessment would be really important. If we're talking about loss of libido, it certainly has to be looking at hormone levels, and then equally, like the physiology, like whether I don't know whether it's a man or a woman. So
yeah, that's what I was wondering as well.
So different techniques, and there are some measures, like there's certainly medications, but I think the assessment would be vital in order to discover why. Well, you'd need to rule out like hormone levels and any other reason, like medications for this cause,
Yeah.
and then move on to kind of I suppose some medical devices or techniques that can actually help.
Yeah. And I think it warrants a much bigger conversation, Helen, and for sure it does.
Yeah.
So, and thank you for bringing that question, because, it's something that people steer away from. But we know for sure that lots and lots of people struggle with body image difficulties and sexuality difficulties. So thank you for that. That's great.
And I think it's lovely that somebody has asked that question, because it may help other people to start opening that channel of communication for themselves if they're experiencing it. So yeah, no, it's great.
Yeah, absolutely. But for sure, it warrants a bigger conversation with your team.
Yeah. Okay, and another one here, Mary, from an anonymous attendee. Hi, Mary. I am 6 months post breast cancer treatment with 3 young children under 12. I get very fatigued some days, but it's hard to explain this to my children. As I look okay, any tips? Thank you.
Yeah, and this is a challenge when you look okay. And it's also a challenge because often people come along and say to you, oh, you look great, but you feel so tired, you feel exhausted. And, as anybody who has 3 children under 12 know how busy that is. That's a busy household. It's also been even more busy in the last few months because nobody's going to school. So, mums and dads are doing everything. They're doing teacher, they're doing everything. So, and trying to work sometimes really difficult hours to try and keep everything going. How do you explain it to children? Mm-hmm. So I guess different ages, something might be more appropriate for the older age, and So I think what I would do there is plan, pace and prioritize, for sure. And the 3 questions that I suggested, you know, does it have to be done by me? Does it have to be done today? And is it important? I think those questions are so helpful. You know, we often get caught up in maybe chores that are actually not vital. And when you've young children, you can really be in that. And when you reflect back, you might think, actually, maybe it wasn't that important at all. But 6 months post-treatment, what I would say is if the fatigue doesn't improve, I would definitely be talking to my team about that. I'd be looking at if there is, you know, a program in your cancer centre for fatigue, for sure. Because, you know, it is hard to explain to young children. It's hard for them to understand. But also in terms of the guilt, there's probably, you know, guilt that, you know, maybe you weren't available because of you needed treatment for the time you were in active treatment or attending chemotherapy. And it, you know, kids, which is really important. It's really important that they're not worried about you, I guess, and that's a good thing. You know, that's normal that children are not worried about you. But maybe that warrants a bigger conversation as well, Helen.
Yes, I think so.
Yeah, definitely.
And maybe even like referral to a cancer support centre locally, you know, where that might be a useful conversation to have too, with the support of counsellors and their, you know, climb programs for children.
Yeah, and the other thing is that a lot of the cancer support centres are doing online and telephone work now, and it's an invaluable resource. But so it doesn't even have to be local now, because, you know, it doesn't matter because it's on Zoom or telephone.
Yes.
So yeah, I definitely, that's what I meant by, you know, tapping into your resources, looking for resources, trying to find out what's available. Yeah, definitely. And definitely maybe trying to get some help around the conversation with the children, depending on what is age appropriate for each one of them.
Yeah. Okay, Mary, there's lots more questions here that we're not going to get through.
Okay.
In the interest of time, I guess we probably need to close off. I can see questions there from Judy and some more from anonymous attendees. So Mary, I think you may well be able to answer these, and we'll put them up on our frequently asked questions site, hopefully. In the next couple of days. Yeah, no, that'd be great. Thank you. I'd like to thank everybody for putting through their questions. You know, it's really invaluable to be able to ask questions at a webinar like this. It's invaluable to have somebody like Mary as well to be able to answer them. So thank you, Mary.
You're very kind, Helen. Thank you very much. And thank you to the audience and to Judy and everybody else and Kieran who asked questions.
Yeah.
And to your anonymous listeners. Thank you.
So Mary, thank you so much. It's been a great pleasure to have you. It's been a great pleasure to be in people's lives over the last 6 weeks as well. It's an honor. And that comes from all of us here at the Mary Keating Foundation, and I'm sure yourself as well, Mary. I have a couple of slides now that I'd like to share before we go. So I'm just going to share my screen very quickly. So there's some useful websites, our own website, marykeating.ie, and government website and the HSE website. And then just to refer to a couple of the websites that Mary mentioned there, the National Comprehensive Cancer Network, which is really good for fatigue and learning more about it, and then the American Cancer Society, learning more about concentration levels. And do tap into our own website, surviveandthrive.ie. There's lots of useful information in there too. So we've done our Q&A. And what I'd like to do now is just, I suppose, remind everybody of the work that Mary Keating does, and know that we are there for you every step of the way. We do a lot of work in health promotion, and Bernie, our senior oncology nurse there, along with other nurses, does work in corporate wellness webinars and community outreach. So we're educating people about the signs and symptoms of cancer all the time. We're enlightening people rather than frightening them, hopefully, and actually encouraging people to come forward if they have any symptoms, so that if it is something to worry about and it is a cancer, that it's caught early and treated well. We also run Survive and Thrive workshops. These are 6-week programs. We did do them face-to-face, and we're faced with challenging ourselves to do them online, which I think is a very doable challenge, because we need to continue to meet the needs of people who are surviving cancer in Ireland, and there's almost 200,000. We have an Ask the Nurse service, and of late we have been receiving, complex calls, because everything has become a little bit more complex and complicated because of COVID and because of how the acute setting is. So, we'd encourage people to ask any questions if they have real concerns and worries. And also, I would pay tribute to our Positive Living group. I facilitate 2 weekly webinars with this group. They're very important. They're very together. They support each other and empower each other. So, and I know some of them are listening in tonight. So we're delighted to be able to offer that support during this extremely difficult time for people, like those in cocooning and isolating, and finding it extremely difficult as time goes on. I'd like to bring you to our ribbon wall of love. And this really is to celebrate people's lives, celebrate those who are on a cancer journey and those who've come through, and also to remember and commemorate those who have died from cancer. I think it's a lovely tribute, and it's always something nice to do, to remember somebody at a special time in your life. And last but not least, we are going to have a makeup workshop, Look Good, Feel Better, on the 18th of June from 7 to 8 p.m. It's virtual. So you may know Mary Drummond, who's a lead makeup artist in RTE Dancing with the Stars. And she's going to take us through some makeup tips and techniques in a 1-hour confidence boosting workshop. And we'll have one of our ladies, Roisin, online that night, actually applying her makeup virtually through the direction of Mary Drummond. So I think that's a really nice way to finish off this webinar series, and just to treat ourselves a little. So I suppose last but not least, just to say, please stay safe, protect each other, hold firm. Together we will hold firm for the people we love and the things we miss and the future that we hope for. So stay connected with each other, and we will make it through together. Thank you so much for being part of our webinar series. And thank you, Mary.
You're welcome. Thank you.